Are you one of these people who wakes up in the morning with thoughts of impending doom? Or you have incessant nightmares that wake you up in the middle of the night, your heart's pounding, you wonder what the heck is wrong with you and why you're processing thoughts or dreams like you're having? Now, it's normal if you have a pulmonary embolism or if you're having a stroke to have these types of thoughts, but there's many people out in the public who not only wake up in the morning with this, but they also receive phone calls, and when they get a call from a person, they automatically think the worst is going to happen. But there's also a large sector of the population, which is the majority, that don't have these things. And if you are having these things and you went to a mainstream doctor, they're usually going to refer you to a psychiatrist and diagnose you with an anxiety disorder. And then they'll probably prescribe you Celexa, Wellbutrin, Prozac, Zoloft, or one of the psychiatric medications, which of course at times have value. However, if you're dealing with these things and you are on medication and it either hasn't helped or you'd like to get off of it, I always ask the question, why do these people have these problems? Is it because they have a drug deficiency? No, it's because something's not working right in the body. So the central nervous system, which is composed of the brain stem, which sits inside of this top vertebra in the neck called the atlas, and below it is the spinal cord. The nervous system controls every single function in your entire body, and not only with anxiety disorders, but other chronic issues that people have. They can have their roots in a structural problem at the base of the skull that's irritating the central nervous system, it's decreasing your body's ability to function properly. And all health problems is your body's not working right. Now, our healthcare system looks at the end result, the symptom, and then they name it, and then they throw a drug at it, generally speaking, to treat it. But if you want to get to the underlying root cause, you got to find out what's causing the body not to work right and get it out of the way so the body can work better. And what I'm suggesting, one of the things that you can look into is called upper cervical chiropractic. It's a specialty that focuses on the top few bones in the neck and their relationship to the central nervous system. And if you go into an office like ours, they will run you through a battery of tests to assess, do you have the problem? If you do, where? And then once they know where, we'll take a 3D image to look at how these two joints fit to the bottom of the head. Because if that vertebra is out of position where those two joints fit, that segment and the joint will misalign. You'll actually be able to visualize it on the 3D imaging, which tells us what direction, how much, what the angle of the joint is. And then the goal is to introduce a very precise correction with no twisting, popping, or pulling to restore normal motion to the segment, which removes the irritation off the cord, allows the central nervous system to work better, and it gives you, from a neurology standpoint, your best chance at functioning at your optimum over time. Hope this message has reached some people that are dealing with these things, because I know that when you tell these things to doctors, they look at you like you're a little crazy. You're not crazy, you're just not working right.